Hello there, it's Teacher Aunei again. So today I'll be talking more on ADHD and LD, which is Attention Deficit Hyperactivity Disorder and Learning Disability. So first of all, what is ADHD? So ADHD is a neurodevelopmental disorder. There unfortunately is no known direct causality to it. However, research have shown that boys are highly likely to have ADHD as compared to girls. What are the types of ADHD that are present according to DSM-5? There are three types of ADHD. The first one is the inattentive presentation, second is the hyperactive impulsive presentation, and the third is the combined presentation. So combined meaning both having both inattention and also hyperactivity. So what are the differences between the symptoms of these types of ADHD? So for inattention or inattentive presentation, that we will see that children have failure to attend to details. So tiny details are more difficult for them to be more aware of it. For example, if you are showing them how to eat, they know how to bring the food to the mouth and eat, but they probably forgot or were not able to attend to how many fingers did you use, which utensil did you use. They will also have difficulty sustaining attention, meaning that they might have a very term short span of attention, very fleeting attention. This also causes them to have the inability of active listening. So it's very difficult for them to have proper listening skills. This would also lead to difficulty organizing. So children who have the inattentive presentation of ADHD are often seen as disorganized or messy because one of the active symptoms is the difficulty of organizing their thoughts and also their behaviors. They would also avoid sustained attention tasks. So tasks that require sustained attention, such as homework, um, doing lengthy essays, or doing mathematics, would usually be avoided. Those with inattentive presentation will also be seen as easily distracted and forgetful. So their attention, as mentioned before, their attention span is very small. Hence, while doing one thing, they might suddenly be distracted by the noise or be distracted by the visual they see in another object or another person. They are also forgetful in terms of forgetting how to do, not forgetting how to do. I mean, forgetting the tasks requested by the parents, forgetting the homework teachers gave them, or even as simple as uh, forgetting every step of how to bake a cake, or forgetting every step of how to wash your hand or how to tie your shoe. Next is the hyperactivity symptoms. So, what is hyperactivity? Hyperactivity can be seen in children through their constant fidgeting of hands, fidgeting of legs. This can also be seen as an inability to sit still. So it's very difficult to ask children who have the hyperactivity symptoms of ADHD to sit on a chair, to sit down on the dining table and wait for food, or to sit down and wait. Difficulty in playing quietly. So they tend to have big actions because they're very active. So it's very difficult to, for example, if you were to leave them in the library and ask them to play by yourself quietly, please. So they tend to show difficulty in following these instructions. They would also show an excessiveness in talking. They either talk too much, talk too loud, or talk non-stop, despite being asked to stop. And this would also lead to the next symptom of disruptive talking. Because of their inability to stop, they tend to disrupt other people and mencelah, menyampuk, mencelah disrupt the conversation that is ongoing because they have to say their piece. This also leads to the next symptom, which is they appear to constantly be on the go. Their engines are always running, so they need to go, they need to deliver it right at that moment in time. So similarly to the hyperactivity, it leads to the impulsivity symptom in people with ADHD. So what is impulsive? Impulsivity is the inability to wait for turn. For example, it's very very difficult to play cooperative game with them. If you were to play Jenga, every turn is their turn. If you were to play card games, you need to hurry up. If not, they would be bored or they would rush you because they are unable or having difficulty to understand the concept of waiting for their turn. And there also will have frequent and incessant interruptions, similar to interrupting talking. They will also interrupt your actions because they're very impulsive in a way that I have to do it right now. I have to say my piece right now. There's no waiting period for them. And this would also lead them to blurt out answers before thinking twice, to blurt out answers before the teacher finish asking. So for the children with ADHD, what kind of behavior can we see in them? So some of the behaviors that are often seen in ADHD children are having low frustration tolerance. So once they're frustrated, it's very easy for them to to blow up because their frustration tolerance is very small. It's like having a smaller cup of tolerance as compared to normal children. They would also shows a lot of sleep disorder. This is because of the uh, high intensity of activity going in their brain, that they will always have energy despite being physically tired, for example. So it would lead them to having difficulty to initiate falling asleep or to stay asleep. Some of them also exhibit bossiness attitude. They will also have excessive demands for attention. So they will always crave for attention from other people. They might also have mood lability, so a constant changes in mood, very labile, very easily move from a good mood and suddenly going to bad in an instant. Due to all the above too, it might lead them to have constant demoralization. So they have constant frustration of the inability to do things or being told off. So this demoralize them, making them have lower self-esteem about themselves, which would lead to dysphoria, or better known as rejection sensitive dysphoria for children with ADHD. This is when you experience severe emotional pain because of feeling rejected. So when people keep on telling them no, or when they were told off by their teachers, parents, superiors, uh, their brain structures are unable to regulate those emotions. So that painful emotion is felt even more for people with ADHD. And similarly, as I mentioned before, this lead to poor self-esteem and feeling rejected by peers and others. But then, Teacher Aunei, isn't it normal for children to be active? Isn't it normal for children not to behave as well as the adults intended them to? So how do you differentiate from a child that is just simply being a child and a child of possibility of an ADHD symptom? So first, you need to see the degree of impairment. Is it very high to the point that it messes with the daily functioning? For example, they have sleep difficulty to the point that they can't sleep for 1 week straight, or to the point that they messes with the parents' sleep routine, or they can't wait for turn to the point that they keep on arguing with their peers despite being told off. They can't listen. So the degree of impairment in children with ADHD are usually higher even with constant reminders. And how frequent does this happen? Is it just once out of the blue moon or is it daily? And usually with ADHD diagnosis, the professional will see, does this happen more than 6 months continuously? And does it happen across multiple settings? Does the kid only misbehave when they're at home? Or does they only misbehave at school because they do not want to do the thing that the teachers ask? Or is it everywhere? So people with ADHD are unable to control their behavior. Hence, this behavior, the symptoms mentioned just now, would be available to see across setting. At home, they'll be behaving the same way. At school, at playroom, in the public, they will be behaving the same way. And these behaviors are maladaptive and interferes with daily functioning, as mentioned just now. Now, what about learning disability? Are people with ADHD unable to learn as well? Or is learning disability meaning that my kid have low IQ? So no, learning disability and intellectual disability is two different things. Learning disability is the this difficulty in academic learning, difficulty in processing new things to learn. So it usually encompasses of the auditory processing, the language disability, and also the perceptual impairment. So again, DSM-5 mentioned that learning difficulty often come with impairment in reading, impairment in mathematical reasoning, or impairment in written expression. So these three different impairments are often accompanied in the difficulty in learning. Teacher Aunei, I think my children is just slow. Biasalah tu, kadang-kadang ada anak ni lambat sikit belajar, kadang-kadang ada yang cepat sikit belajar. So how do I know, Teacher Aunei, that this is an actual disorder? Again, it is better if you were to seek for professional consultation. However, how to notice it first? How do you want to know that, oh, should I? Is this something of a concern? So first of all, you need to see whether they have difficulty in learning and using academic skill that persisted for at least 6 months. So 6 months or above, you give them tuitions, you teach them at home. So you give targeted intervention, for example, you give mathematics skills every single day if they're poor in mathematics. But they seem to have little to no improvement. Or if the affected academic skill, for example, again, maths, fall below expected age and it interferes with normal studying. For example, if your child is 5 years old, but they can't do basic mathematics as simple as recognizing the numbers, which is very, very low compared to peers of the same age. This is something you might need to tickle your brain and say, oops, is this a normal slowness in learning or is it something more? That is the difficulty began since childhood. So you can see maybe they've been struggling with numbers since their baby. However, for learning disability, again, since it's not intellectual disability, you might only see it manifested when there is a higher demand for it. For example, when your kid already started to go to primary school or kindergarten, when there's homework to do, when there's presentation to do, then they started showing more and more of this difficulty in absorbing mathematical learning, absorbing reading or comprehension. So what are the behaviors that are usually shown in people with learning disability? So the occupational therapist suggested nine different behaviors, nine different categories that would exhibit different behaviors in children. So first of all, those with motor functioning disabilities. This would affect them in terms that they became more clumsy. They would have poor gross and fine motor skill. They would have dyspraxia, poor equilibrium, and poor sensory motor. And they would show either a hyperactivity in the sense that they move too much, they talk too much, they're just very hyper, or a hypoactivity in which they don't talk, they don't move, they lose all motor ability. Next is in terms of educational, as mentioned before. So people with children with learning disability would have limited or show limited or delayed academic skill. Next is they would have poor attention and concentration. They would show a very short span of attention, similar to those with ADHD. They would show restlessness, impulsivity, and having motor and verbal perseveration, meaning they would do the same thing. They would say the same thing, they would do the same thing that they know only, and they wouldn't go beyond that. Next is thinking and memory. So the behaviors that affected in thinking and memory is the difficulty with abstract reasoning and concept formation, leading to poor development of memory because they couldn't even understand the concept in the first place. The fifth one is the speech and communication category, in which they show difficulties in shifting topics, engaging in small talk, and forming sequences of words. This would also lead them to having slurred word or articulation problems in terms of vocalizations or babbling, still even at the age of 7, for example. So it would also affect their auditory. They would have auditory, perceptual, and memory problems in which they would have difficulty remembering oral direction, having difficulty in phonetic, in listening, in understanding phonetic, and also having to actually use them, have speech in voice noises, and also have auditory sequencing. They couldn't understand or they couldn't sequence or redirect the auditory that they're hearing. The seventh one would be the sensory and perceptual category, in which they would have difficulty in laterality and directionality concept. So they wouldn't be able to understand as much as normal children. About left and right, how do I use both my hands at the same time? When imitating others, if they're showing left hand, can I also lift up my left hand, or would I do it the opposite way? So these are affected with the behaviors that are affected in children with learning disability. So the F is the one would be psychosocial disturbances. So they would throw temper tantrums. They would have delayed competencies and very low self-esteem. This would be portrayed in their psychosocial behaviors with other peers, for example, or within when they're socializing with the families. And last but not least is the specific learning disabilities. As I mentioned in the previous slide, specific learning disabilities is when they show difficulty in specific area of learning such as mathematics, dyscalculia, or difficulty in reading, or difficulty in written expression, dysgraphia. Alright, okay. So Teacher Aunei, now I understand that there might be some issues that my children is having that is beyond just being slow. Uh, okay, I'll try to bring them to the hospital and see. Would that be enough, Teacher Aunei? Would it be enough, Teacher Aunei, if the doctor gives some medication for that? So, yes, there is indeed medication as a treatment for ADHD and learning disability, but that is mostly for concerning their overactivity, their attention span, their impulsivity, and reducing their aggression. But would that be enough? Yes, as you asked. Unfortunately, that would not be enough as a standalone, as it would not treat it would not improve it would not the whole ability that the children have. So it is also recommended that the medication, if taken, to be also partnered with a behavioral therapy. So this is included to enable or to help the children to improve their reading, to improve their socializing, to improve their learning, to improve their academic achievement, and of course, to improve the way they behave. To understand, how do I behave in a social setting? How do I behave in a table sitting mannerism? How should I behave in a certain situation that would not hurt myself, would not hurt others, and would be accepted by all people around me? Alright, so that is all for today, learning about attention deficit hyperactivity disorder ADHD and learning disability LD. Again, today we learned about the symptoms and the behavioral affected, and also the two treatments method, either medication or behavioral therapy, that can be used to treat children with ADHD and LD. So you have more questions? I hope you can contact us at Autism Gym Center to understand more on how behavioral therapy works. Thank you.